Hi, hair is very important part of man's personality. I myself has undergone 2 sessions of hair transplant in the frontal and the mid scalp area, and the area where the hair transplant has not been done, it does require maintenance. So I regularly take medications. I do GFC treatment regularly, and today I am having my session of GFC to improve the condition of my crown area. So stay connected with me to see how my crown area is improving with medical treatment along with GFC. Bye-bye. Now I'm going to have my GFC treatment in the crown area, and first thing I'll have a block, local anesthesia, scalp block, so that there is less pain and discomfort. So I always advise my patients to take local anesthesia before the GFC or PRP treatment. So here I am. The first process of cleaning of scalp is undergoing, and then anesthesia will be given. As you know, I'll be my friend will be using vibrator so that I will feel less pain and discomfort. Already my scalp has been anesthetized and the GFC is ready to be get injected into my scalp. So guys, there is no pain and my scalp is totally numb. I am not able to feel anything, not even a prick. Yeah, all good. So from the pictures, what I am observing that there is some improvement, and today I am having my second session of GFC, and it is recommended that the GFC session or a PRP has to be taken a monthly interval, 6 sessions, and then if required maintenance every 3 or 4 monthly. Along with that, one must continue hair vitamins, minoxidil, and healthy diet, fresh fruits, dry fruits, refrain from active and passive smoking, do regular exercise. That's all. Also, in male patients, I recommend to take finasteride 1 mg once a day if the patient is not having any problem in continuing it. And in females, one must evaluate hormonal profile if there is a deficiency of iron or some hormone problem, so that has to be addressed. And hair serums also is recommended. So nowadays, good hair serums, minoxidil combinations are there that has to be applied on scalp morning and night, and continue other medications and stay in regular touch with your physician for more information. Ow! So ready? My head is feeling as if tons of kg is there on my scalp due to local anesthesia. Bye-bye.